Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Well, hear about, but we might not know quite as much about as we could and probably as we should. So our plan for today is to review the history of the minimum data set, start to understand its role in nursing facility operations, look at some differences between the MDS 2.0 and 3.0, and explore some ways that we can assist with this process, really assist with information gathering for this process. So before we go any further, it begs the question, what is the MDS? Well, I think that the short answer is it's the most important document in the facility. Any of you on the call who now work for hospice but used to work for a nursing facility, that would ring true to you, I am pretty sure. MDS assessment forms, and we're going to talk about the forms, are completed for all residents in nursing homes that are certified for Medicare or Medicaid. They're completed on all residents regardless of who's paying for that individual resident. So it affects private pay patients, VA patients, anybody who's in that nursing home, as well as those patients, those residents for whom Medicare and Medicaid are paying the facility. These assessments are required for residents on admission, has to be completed within the first 14 days, and then periodically throughout their stay at the facility, and that's guided by specific guidelines and some time frames. Usually, always the person who's completing the MDS is a registered nurse. They may well be getting information from some other licensed healthcare professionals, and then that information is transmitted to the state. In the download section for this call, there's a sample copy of the newest version of the MDS. The version would say 3.12 on the front page. It is a sample of a proprietary copy, which is why it says sample all over the pages, but it gives you a good idea of the type of information and the type of questions that are located on there. The history of the MDS came on the scene in 1990, and it was developed in response to findings, particularly some seminal findings by the Institute of Medicine in 1986 about poor nursing home quality, really finding some widespread situations of substandard care across the country in nursing homes. And so Congress mandated that there be the development of something called the Resident Assessment Inventory. You often see these letters, RAI. It's a multidimensional instrument to guide the assessment and care planning with the goal of improving quality of care. As the Medicare folks, as the regulators looked at nursing homes and looked at this poor nursing home quality, they thought, well, everybody's using their own assessment form. Some of them are better than others. What about if we create a standardized assessment that will be used across the country? Will that help things? So those of us in hospice, we need to think about this process because while we don't yet have a comprehensive assessment, remember that we're kind of in the same boat. Not that the care is bad, but each one of us develops our own assessment form. Our conditions of participation that were released in 2008 are filled with requirements, and they use the word comprehensive assessment or update to the comprehensive assessment. So really the regulations have been written for us to have our own version of a standardized assessment, our own version of an MDS or an OASIS, because we saw that same thing happen in home health. So the decision was made to develop something, and by 1990 it had been done, was ready for release, a lot of work went into it, and it arrived on the scene. That one stayed in use until 1996, and the MDS 2.0 was implemented. Many of us, that would have been the first one that we were familiar with. In 1998, and this is
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.